I'm Dr. PK, board certified internist, practicing in California for 30 years. Yes, 30 years. Seems like a long time. Now, these videos I'm making is for educational purpose only. So this is a second video about hypertension. So when you are prescribed a blood pressure pill, you aren't just taking something to lower a number on a screen. You are adjusting a complex hormonal or mechanical pathway in your body. And today we are going to decode the four primary pillars of anti-hypertensive pharmacology so you can know exactly what prescription is doing in your body and what specific safety measures your doctor should be checking and what side effect you should be looking for. So I'm going to break this down. There are four classes of blood pressure medication normally what we use. One is ACE inhibitors, or ARB, that includes lisinopril, ramipril, all ending with the prils, and sartans like losartan, valsartan. That's one class. The other class is calcium channel blockers. We call them the dipines, like amlodipine or nifedipine. And then third is diuretics water pill, which is hydrochlorothiazide or chlorthalidone. And the fourth is beta blocker, the olols like metoprolol, atenolol, bisoprolol, and those medication. Propranolol, people have a hard time even saying and remembering it. We call them the olols though. So ACE inhibitors and ARB, the prils and sartans, and those medication, they work by blocking a powerful hormone axis called ROS. Okay. Renin-angiotensin system. Okay, this relaxes blood vessels, and when you are taking this medication, make sure you start at nighttime because they are known to cause hypertension, dizziness, and so I tell my patient to take this medicine at night. Now, coming to calcium channel blocker, dipine, amlodipine, nifedipine, they work by relaxing blood vessel. They're calcium channel blocker. They block the calcium entry into the smooth muscles of your tiny blood vessels, and result is relaxation of blood vessels because blood vessels need calcium to contract, and we are trying to relax these blood vessels because one of the features of hypertension is sustained contraction or constriction. So this medication relax, but some medication like amlodipine, they are known to cause ankle edema, swelling on your feet, and that can be problematic, particularly the higher dose. 2.5, 5 milligram is really good. 7.5 and 10 milligram, you usually see edema, so you got to be careful with that. Now, diuretics and water pill medication like hydrochlorothiazide and chlorthalidone. Remember, we do not include Lasix. Lasix is not used, or furosemide is not used for blood pressure. We're talking about hydrochlorothiazide, chlorthalidone. They lower pressure by helping your kidney flush out excess sodium and water volume. Excess sodium and water volume. Not if your body does not have excess sodium and water issue, then this medicine may not work for you. Okay. Then fourth is beta blocker, the olols, medication like metoprolol, atenolol, bisoprolol. They slow down the heart rate and they reduce the raw force of your heartbeat. So taking the constant stress off and overworked heart muscles. Okay, so here is a critical secret I want to tell you. So potassium balance is very important whenever you're taking this medication. You must know your pills will affect potassium. So standard diuretics like hydrochlorothiazide, chlorthalidone will deplete your potassium. And that requires careful dietary management or monitoring. However, ACE inhibitors like lisinopril or the sartans like losartan, they and also other medication called aldosterone blocker, called as spironolactone. They do exact opposite. They cause your body to retain potassium. So if you casually take potassium supplement or use a potassium based salt substitute while on this medication, you could inadvertently drive your levels dangerously high, especially in your heart's electrical system. So anytime you are on ACE inhibitor, ARB, diuretics, every now and then you need to check your kidney function and check your potassium. Very important. So a comprehensive cardiovascular audit means managing your medication safely alongside your regular metabolic blood work. And that's a renal function, renal panel should be checked. In my final installment, we'll look into how insulin resistance impacts your blood pressure and how to lower these numbers naturally. So make sure you watch that video. This is my second video. I'm going to do the third video before lunch so that I don't miss it. And that's going to be part of the series for about hypertension. Thank you for watching. I'm Dr. PK from Dr. PK.